Welcome to the Quantum Legacy series, where we revisit the original shortwave radio broadcasts of Dr. Robert Marshall, founder of Quantum Nutrition Labs. These episodes are a window into the early days of clean, quantum state nutrition, a philosophy that still drives everything we do at QNL today. Please note, this is archival content. Any product mentions, pricing, or special offers discussed may no longer be valid. Let's dive into this timeless broadcast and explore the legacy that helped shape the future of natural health.
Welcome to Healthline Now, hosted by world-renowned clinical nutritionist Dr. Robert Marshall, PhD, of Quantum Nutrition Labs. He believed that the secrets of optimal health lie not within costly techniques, but in the body's own theorized energy field. Using these concepts, Dr. Marshall touched the lives of countless people throughout the globe with this effective and insightful nutritional system, a methodology he coined as the quantum nutrition effect. Don't miss this nutritional legend whose insightful ideas revolutionized natural health care. To speak with an experienced representative regarding your own health concerns, please call Monday through Friday, 9 a.m. to 7 p.m. and weekends, 10 a.m. to 7 p.m. Central Standard Time. We hope you and your loved ones can experience the quantum nutrition effect. Please join us for Healthline Now with Dr. Marshall.
Welcome to Healthline Live. We're here to answer your nutrition and health-related questions. Never before in recorded history has your health been under siege as it is now. We make the best cars and the worst food, and it's time to learn how to tiptoe through the mausoleum where the dead food lies in state called the supermarket, and find something that can nourish and protect your family through the years to come is in terms of their health. So today we're going to focus on the liver, and this is one of the most spectacular organs. You can lose up to a third of it, and it can regenerate itself in less than 2 weeks. This is probably the most robust, but also this guy takes a beating, because when you eat, all the food, whether it's been digested well or not, is dumped in your liver. So it's also takes a terrific beating. Its cohort, hooked right up to it, is the gallbladder. And this guy can jam up, and then the waste products that the liver has isolated from your food can't be released. So obviously, most of the time, we need to support our gallbladder at the same time we support liver, but liver support. This is one of the best products, a very effective broad-spectrum detox for the liver and liver support. These are capsules. Typically, if you're under 165 pounds, you might want to take 1 or 2 per meal. If you're 200 pounds or more, you might want to take 2 to 4 per meal. And wow, I've never seen anything that helps the liver when it's an issue of structure and function like liver support capsules. Now, sometimes there's an immune issue with the liver, and if that's true, then you can take liver support capsules and add to it one of the ultimate players on the block for immunity and for the liver, that is, and it's Reishi. This is a mushroom that is also known as Ganoderma lucidum. And you ought to go online and look at what this guy can do for your liver, especially if you have any immune challenges for the liver. Go out and take a look at this guy. But if we're going to use it heavy duty for immune support for the liver, you might need to take 12 to 16 capsules per meal for about 90 to 120 days. Reishi nutrition that really works. There's no garbage in this. We didn't roll it in oil so we could get it in the capsule and then let the oil make it go rancid. This is the straight powder. So it's light, it's fluffy, but it really, really is great nutrition. After you go online and see what this does, you may want to get a case of Reishi. Do remember, we've got a lot of clinic experience using this, and I can tell you that you better fix your first morning urine pH, or at least be working on it hard at the same time you use Reishi. Otherwise, you just have an expensive way to get your morning urine pH back where it belongs. So let's not do that. Give a buzz to our order line, 800-370-3447. 800-370-3447. All right, let's go right to the phones now. This is Dr. Bob Marshall, PhD. This is Healthline Live. We're answering your nutrition and health-related questions. Let's go to Aaron in Seattle, and he's got some concerns about the thyroid. Are you there, Aaron?
Yes, sir. How are you doing?
I'm doing great. How old a man are you, and how much do you weigh?
47, 250.
Okay, first thing you want to know is that it's very common for the thyroid to have swellings or to swell. This is very commonly induced because of lack of iodine, okay?
Oh, okay.
And it's very, very widespread. So the first thing that should be done here is to make sure that the parathyroid is happy, because energetically it controls the thyroid. Biochemistry doesn't know that, but energetically it controls. So you'll want to take Medi-chlorella.
Okay.
That will promote the best health for the parathyroid, and that may allow the thyroid to uptake iodine. Now, the iodine you want would be something like Xeno-X, and you're going to want to take about 12 caps per day, all at once, at the main protein meal.
Okay.
Now, if you don't see a big change in this within a month, there may be something more complicated going on, but as long as those swellings go away, your doctor is going to be happy, and you won't need to do a biopsy or any other weird stuff. Okay?
Okay. Now, so I have a forehead scar.
Which could be sedating the parathyroid and or thyroid. You may also have mixed metal restorations in your mouth. Yes. Dental work?
Yep.
Yeah, okay. You're going to need, you can follow my couple recommendations, but you need to visit with somebody, because the parathyroid may be more complex for you simply because of the metal coming out of your mouth may have electroplated the thyroid or parathyroid. So call Healthline. They'll be able to help you. Okay?
Okay, definitely. I don't want to lose the thyroid.
No, you don't.
Thank you, sir.
You're welcome. Bye now. All right. This is Dr. Bob Marshall, PhD. This is Healthline Live. Let's go right back to the phones. Let's go to Helga in California, and she's got some acid reflux. Boy, is that common. Hiatal hernia and a little gluten intolerance. Are you there, Helga?
Yeah.
How old are you, and how much do you weigh?
50 and 137.
Okay, well, the acid reflux is the product of eating cooked food when you were engineered for raw food. And at this point, you've kind of beat up your stomach, and it now wants help to digest the food. So from now on, you don't want to eat a cooked food meal without taking one Quantum Digest. If it's a very big meal, two, but most of the time at your body's size, you only need one. And then...
What is that? I'm sorry?
Quantum Digest, pancreatic enzymes from plant sources that will help you to digest protein, fat, and carbohydrate, the components of your food. Mm-hmm. Then the end of the meal, you will take the HCl Detox kit. And here for you, about 2 HCl, maybe 1 activator. You might need 3 HCl if you eat, a really big meal. And
small. I eat a small.
And now, then 2 is plenty. Then you should notice that there's no acid reflux anymore. Occasionally, people will have burning after they take HCl, but that's only if you've got a scar or trauma on the center line, like a C-section, appendectomy, nose surgery, some injury on the center line. Then if you get burning, you just drink a lot of extra water. It'll clear it right up. And then before you use it again, you get something called stomach support. And you would take 2 of those capsules and make them as a tea. They'll explain that to you when you call the order line. Now the stomach will test on. You take the HCl. It's going to feel wonderful. Hiatal hernias are extremely common. They really you don't have to do anything about them. Gluten intolerance is like a national epidemic. Several reasons. One of the main reasons being that the wheat is not the same quality. Stay away from wheat. I think that's a good idea, but if you can't, then I would take quantum enzymes. These are enzymes that digest gluten, and also help to conclude digestion that would normally be done on the intestinal lining if you had been breastfed to term.
Yeah.
And usually when you have a gluten intolerance, you have not been breastfed to term.
Yeah.
Okay?
And the coughing, doctor? A lot of coughing all the time, at night especially.
Okay. Well, is the coughing producing mucus?
Yeah, in the chest.
And what kind of color is the mucus?
No, I don't speed up. I just feel like
well, that's classic. The body's making mucus to block the absorption of the food you couldn't digest.
Oh.
So as soon as you get on digest and HCl, that should stop. Okay?
Okay, thank you.
You're welcome. Bye now. All right, this is Dr. Bob Marshall, PhD. This is Healthline Live. We're answering your nutrition and health-related calls. Let's go to George in Illinois, and he wants to know how he can gain some weight. Oh, that's going to be fun. Are you there, George?
Yes, I am, Dr. Bob. My problem is I was about 165, and then I read that Wheat Belly by the doctor in Milwaukee, Wisconsin, Bill Davis, yeah.
Yeah.
And I quit eating. I was a big wheat bread eater, and I quit eating the wheat bread, and I lost 25 pounds.
Okay. Well, how old a man are you?
I am 60, and right now I weigh 147.
Okay. Well, I think you want to put on some muscle mass, right?
Well, at this point, I just want to get...
well, you don't want to be fat and flabby, my friend. And remember, the fat, we know that even 1 pound of fat, extra body fat, is indicted as being a promoter of inflammation and of all manner of diseases. So you don't want to get the weight back and it's all fat. You want to get some muscle back. And so I'm so glad you asked me that, because that is something that we do know how to do. The other problem you have, because you're 60, is that you're prone to muscle wasting. And the two main reasons for this is, number one, you can't digest your food, and number two, there may be a loss in production of human growth hormone. So the first thing we want to do is make sure you can digest your food. So do you take Quantum Digest and HCl?
Yeah, I've been on... I've been on the Digest and the HCl for about 3 years.
So yes, and what a difference that's made in terms of you being able to digest that food, right?
Well, yeah, that definitely helps me digest the food, and I'm really slim. I mean, I have no
body fat.
No body fat. I mean, I
deal.
did have some tests done on body fat, and I was like the lowest of the low, as far as that goes.
It's the lean horse for the long race, and what you can do now, I'll teach you a couple things that should really help dramatically, but this will gain muscle mass, not body fat, okay? The first trick is that, well, let me preface this. You do not want to load food 3 or 4 times a day. That's not going to help. The breakfast time, that's a time when typically the body is at maximum insulin resistance, whether you're thin or you're fat. So it's not a good time to consume anything sweet. The question that really arises is, are you hungry? If you're hungry, then you may eat, but you would not eat something sweet. So you could have low glycemic berries or something like this, but if we're trying to put weight on you, muscle mass, you want to go on to Slim Body Whey, and you will take 4 tablespoons. You'll then get some whey peptine, and you'll take 2 tablespoons. And you're going to blend this with maybe 1 or 2 organic bananas. And in here, you're going to add a 1/2 tablespoon of our Lessie granules, which is lecithin. This is an emulsifier. And the union of the fat and the protein makes a perfect escort into the body. So you've now got this pretty strong drink here, and if I can get you to just do some very light exercise and then drink the drink within an hour of the exercise, this tends to promote muscle mass, okay? So we got these 2 guys. So now when you eat lunch, that should be your main meal, and breakfast, you can have that smoothie if you're hungry. If you're not hungry, you could have the smoothie in the middle of the afternoon. And in your case, you could have one at both times if you're hungry. You'll find, though, when you begin eating this way, there's very little hunger. And you should notice as you exercise now, you can recruit muscle. Okay, buddy?
Okay.
And this is a
Bob.
very, very important thing at your age because many, many people go into severe muscle loss and they can't even lift or work and they have to have somebody to take care of them. So it's really an important thing to do. Okay?
Okay, thank you for all the help. I really appreciate you and all your products.
Thank you so much. Bye now. All right, this is Dr. Bob Marshall, PhD. This is Healthline Live. Let's go to Benny in Chicago. And he has had some carpal tunnel surgery on his hand, and he wants to know what you would do to support the nerves in the hand. How old a man are you, Benny, and how much do you weigh?
Yes, doctor. I am 66, and I weigh about 140 pounds.
Okay. Well, the first thing, of course, you want to know is the carpal tunnel is very dependent on vitamin B6. So we want to make sure that you've got plenty of good B vitamins. So you'll probably want to jump on something like Max Stress B and maybe take 2 teaspoons per day for maybe 2 or 3 months, and thereafter maybe 1 teaspoon per day. Okay? That's number one. Number two, to give the body all the nutrients it needs so it can do the job at the site and really promote its best structure and function, you want to get on something called nucleotides. And there you're going to want to take 2 to 3 per meal, okay?
Okay.
Then the next thing that I would be looking for is to make sure that you have what is needed to promote the best health of the nerve in particular. And for that, you would want to have nerve support. This is a great product that contains all the key players to promote the best structure and function of the nerve, and maybe about 2 of those per meal for about, you need to go about 60 days, and that should be enough, and then you can stop that. Okay?
Okay.
Those are the things I would do that's what I would do right now if I had this issue. You will also need to mud pack that after it heals up because it's quite the interference field. Okay? So
I have a problem with sleeping. I don't fall asleep, and I have to take medication for it.
That's a tough one. Generally speaking, going off to sleep is correlated. There's a deep sleep point right behind your ear on the back side, the distal side of the mastoid there behind the ear, and that is actually an acupuncture point, terminal point for your gallbladder. So often going off to sleep is linked to the gallbladder. So you might want to jump on some gallbladder PG, and at your body size, maybe 2 or 3 teaspoons, and you take that during the day. And often people report that in a day or 2, it's way easier to go right off to sleep. And if that helps a great deal, then you'll probably want to get back to the Healthline and do a 4-month program, and they'll teach you how to do everything, including the coffee enemas that would be needed. Okay?
I see.
All right, buddy?
They would have that information for me?
They'll have it all, you bet. And I've made notes on everything for you, Benny, so if they can go back over everything I told you. Okay?
Okay, thank you.
All right, buddy. Take care.
All
Bye
right.
now. All right, let's go right to the phones here. This is Dr. Bob Marshall, PhD. This is Healthline Live. We're going to go to Nick, and he's in Cleveland, Ohio, and he's got a dental question. He also is concerned a little bit about dihydrotestosterone. Are you there, Nick?
Yeah, I'm here.
Okay, and how old a man are you, and how much do you weigh?
I'm 28 and about 124.
Okay, well, go ahead with your dental question here.
Well, I chipped my lower, I think it's number 11, it's like a lower canine tooth on my left hand side.
Mm-hmm.
And my pH is affected. I think it's from that because it was okay before, and now I can't get my pH right.
How badly did you chip it? Was it a big trauma to the tooth?
No, it just
minor.
One day I noticed it wasn't there.
I doubt that's the problem then. What you'll need to do, I think, Nick, is have somebody check every tooth in your mouth, check your gums. It's probably not the bad guy. As far as dihydrotestosterone, you're right at the age where you can start to get in trouble with that, and the antidote to dihydrotestosterone is oatgrass, Avena sativa, and there's plenty of that in our quantum greens. So if you were to take 1 or 2 tablespoons of that per day, you should see quite a difference. And if this is high, often you're shifting toward male pattern baldness and losing the hair right in the front above the eyes, and it's very frustrating. Right at that age is when I started having a problem, and I got on that, and I still have all my hair.
Sounds good.
All right, buddy. Take care.
All right. All right,
Bye
thank
now.
you.
Let's go right back to the phones. Let's go to Susie in St. Louis, and she's dealing with concerns with her bladder and thinks it's not emptying completely. Are you there, Susie?
Yep.
How old a woman are you? How much do you weigh?
I'm 64 at this moment, and I'm 112.
All right. And did this just happen, or did this happen since the pregnancy, or when did you first notice you weren't emptying?
I had some blood tests done in March.
Okay.
And then I had the results probably a month ago.
Okay.
But
okay, I got it.
I mean, I don't have any really.
Good.
There's
no
nothing
problem.
else going on.
Got it. Okay.
Except
Well,
that.
what I would do if I were you is, I guess I'd go right to bladder support. Go ahead and take bladder support, about 2 per meal, and right along with it, you would take something called garlicidin. This is the active fraction of garlic, the allicin, and it's a wonderful player on the block. You take about 2 per meal. It's a gentle biofilm buster, which often happens in mucous membranes, whether it's in your sinus or in your lungs or anywhere there's a mucous membrane. And this is a nice, gentle way to get at it. You're probably going to need it for about 45 days. And I think you'll just love what that can do. I would also consider doing some exercises for just that little 2-inch area just above the pubic bone. And the way you exercise that is to sit on a table and place your hands at the descent of your buttocks, bend your knees at first, and just lift your knees up and down. You'll feel that it pulls that muscle. After your goal should be 10 per day, and you'll do that for about 10 days. Then I'd like to see if you feel strong enough to extend your leg out completely. And your goal would be to get to 10 per day. It may be difficult to do. And once you get there, then I would try to go to 25 per day. Once you're at 25 per day, you should notice that whole line of muscle is much stronger. If you're lucky, that may help the positioning, and when I say lucky, I mean it, that may help the positioning of the bladder so that there's no residual urine left in there. Okay?
Is it like you're sitting up, it's like a sit-up?
No, ma'am. Your back is laying on the table.
Oh,
you're
laying on the table.
You're lifting your legs up. Okay?
Gotcha.
All right, good luck.
And then real quick, the circulation, anything for circulation. I feel like I have pretty good circulation. I don't take any extra vitamin E, but I just thought I'd ask.
Well, I think if you want to promote the best circulation, there's an awesome product called Delta Boost, and this is the real vitamin E. You can feel it when you take it, and if you want to do that, I've probably used 1 breakfast, 1 lunch, and to really promote best circulation, you'd probably want to do this for about 1.5 years, and then I would cut to 1 at breakfast only. Okay?
And then I always had this problem with whiteheads on my face. I've always had this for forever. They don't ever go away.
Well, generally speaking, that's telling you that you're not metabolizing oils the way you should. And so it might be really good for you to do some gallbladder support. Did you have these as a child?
I've always had them. They don't ever go away. They're not that nuisance to me as visual. They're just always there.
The issues probably started as a child, and it's really going to be a challenge to clear them out, but you'd be working with liver and gallbladder to do that. All right?
Okay.
Thanks for your call.
All right, well, then that's it.
Okay, take care. Bye now.
To find out more about our specials or any of our other great products, call 1-800-370-3447 or visit us online at qnlabs.com. That's 1-800-370-3447 or visit QNLABS.com. Dr. Marshall's comments have not been evaluated by the FDA and are not intended to diagnose, treat, cure, or prevent any disease.
Thanks for tuning in to the Quantum Legacy series, your journey into the foundations of clean, quantum state nutrition. While these broadcasts were originally aired years ago, the principles shared still guide us at Quantum Nutrition Labs today. Please note, any offers or pricing mentioned may no longer be valid. If you enjoyed this episode, we'd be grateful if you subscribed, left a review, or shared this podcast with someone who values natural health. Your support helps us keep the legacy alive. To learn more about our current products and mission, visit QNLabs.com. Until next time, be well and stay connected to nature.